Hello, my name is Melanie, and I'm an RN that works on 5 West. I've been there for about 2 years, and there are a few topics that I would like to discuss with you that are important in the collaboration between nursing staff and the residents here at the Ann Arbor VA. To begin, I would like to discuss important orders. Nurses need orders for IVs and dye orders so we can coordinate with the appropriate teams. Breakfast is served at 7 a.m., lunch at 12, dinner at 5, and the dye office closes at 7 p.m. All meals are made ahead of time. The earlier the patient has the correct dye order, the quicker we can provide the food to our vets. This is especially important for patients who are admitted after 4 p.m., as they may have been in the ER for several hours without any food depending on their situation. Food is one of the first things our patients ask about upon arrival to the floor. Off-tele orders are also important to have for any patient who is on tele if they are able to leave the floor off-tele for appointments and procedures or to take showers. The order can be placed under RN orders. Please contact your RN with any stat orders or changes in orders with time constraints. Now we will discuss nursing etiquette. Nurses will attempt to touch base with the medicine teams during rounds. If we are unable to do this due to patient care, we will page you, or you may call our Cisco phones to communicate the plan for the day to improve patient care. For procedures at the bedside, we will provide you with a timeout form to be completed at the bedside before the procedure begins. After the procedures are over, please place tables and chairs back where they are found and discard all of the procedure waste to help us maintain a clean and safe environment for our patients. Please feel free to contact or consult with your RN regarding hospital policies, especially when making promises to the patient regarding leaving the floor.
Hi, my name is Katie. I am an RN on 5 West. I've worked here for 4 years, and I will be discussing some unit-specific information. While all units are able to care for med-surg patients, there are some differences. 5 East has a surgical focus. They care for pre- and post-op patients and patients followed by the surgical services. 5 East does not accommodate patients needing remote telemetry. 5 West has an oncology focus, caring for patients requiring chemotherapy, and can also accommodate remote telemetry for monitoring only. 6 South has a cardiac focus. They monitor and provide interventions for patients needing telemetry. You will find a chart of additional unit-specific information placed in your team room. I'd like to now discuss lab orders. Lab collect times are Monday through Friday at 700 and 1300. Labs ordered for these times must be ordered as lab collect. Cutoff times for ordering labs for these times are as follows: 5 a.m. and 11 a.m. There are no lab collect draws on weekends or holidays, nor at 1800. Labs ordered for these times should be ordered as ward collect. The best way to have stat lab orders completed on time is to communicate with your nurse. Please call your nurse for these orders. When a new order is placed by the medical team, it embeds within the list of previous orders and it at times difficult to note. Unlike other order systems, CPRS does not notify nurses when the new order is placed on a patient's chart. It is helpful for the nursing staff when a member of the medical team calls the patient's nurse to further relate the message of a new important order. Additionally, our nurses often work without nurse aides and therefore are performing basic care on all patients throughout the shift. This could lead to a nurse providing patient care for a half hour or even an hour at times before she is able to check her orders. To conclude, please contact the nurse for important new orders via phone call or finding them on the unit. Thank you.